To help us celebrate this important milestone at the college, we have a great lineup of speakers today, including Elizabeth Cranwell of the Board of Visitors, Charlotte Perkins, Health System Corporate Development Officer, representing Dr. Rick Shannon, and Marcia Gillum, College Board Chair and UVA-Y student, Peter Valadez. Thank you all for being here. Also present today are dedicated members of the UVA-Y's College Board. We had our board meeting this morning, so we're thrilled to have them here. Our several foundation board members and members from the alumni board. Finally, welcome to all of our members of the UVA-Y's community, student, faculty, and staff who will directly benefit from the new WISE clinic that you'll be seeing a little bit later today. Thank you so much for coming out for the opening. I'm thrilled to usher in a new era at the University of Virginia's College at WISE. With generous funding and support from the UVA Health System, I'm pleased to present to you the UVA Student and Employee HealthWise Clinic, located behind me on the first floor of Cantrell Hall. UVA-Wise is the fortunate beneficiary of a brand new, fully staffed and fully operational clinic featuring world-renowned care and state-of-the-art technology at the staff's fingertips. All of this is within a short walk from our offices and residence halls. This new opportunity for UVA-Y students and employees was made possible under the vision and direction of Dr. Rick Shannon, who oversees the UVA Medical Center in Charlottesville. Dr. Shannon brought together a team of very dedicated staff leaders to manage this project, from Charlotte Perkins to Melissa Webb. Raise your hand, Melissa. And HealthWise Medical Director Amy Salerno, who joined us this week, helping with student-athlete physicals. She had to leave last night and couldn't be here with us today. They've done a wonderful job to execute and implement Dr. Shannon's vision. They've also had the support of UVA-Y's facilities, IT, and capital project staff. And I'm grateful for how seamlessly everyone has worked together to deliver this breakthrough project in less than 6 months. I'm thoroughly impressed with the speed and urgency of the task and without the slightest compromise in quality or care. So thanks to everyone for your hard work. And I see Joe Kaiser out there. I know Joe helped a lot with all of the contracts and work that we had to do as well. So thank you, Joe, for that. So what does this clinic offer to UVA-Y's? First and most obvious, it offers our college community access to a full-time nurse practitioner, Johnny Bledsoe. Is Johnny here? There she is, thank you. And full-time nurse Lisa Fisher. Is Lisa? There's Lisa. Many of you may know Lisa, who was in our clinic before, and Lisa is now a UVA employee and joining us. So we're so pleased to have you in the clinic. There are 2 new associates, Starla Hurd and Jamie Soward. Starla and Jamie are right there too. Welcome to all of you. And second, it offers us access to the world's best trained physicians through telemedicine technology. That means we can communicate in real time with primary care physicians and specialists in Charlottesville on a range of issues requiring their consultation. Through telemedicine, we reduce We reduce days away from school or work, and we save time and money traveling to other facilities. And third, it gives us convenient access to the #1 hospital in Virginia. For the 3rd consecutive year, U.S. News and World Report has ranked the University of Virginia Medical Center as the #1 hospital in Virginia. This clinic is a clear win in promoting the wellness of our students and employees. I would like to share a few notes of reflection on the UVA health system and its role in the Commonwealth. In the year 2000, UVA-Y's co-hosted a medical conference with the UVA Vice President and Provost of the Health System, then Dr. Robert Cantrell. Of course, it wasn't here then, but in going through our files and talking with staff who worked at the college at the time, it's clear that UVA is and has been at the forefront of expanding access to health care through telemedicine. In a presentation from Karen Ruban on November 16, 2000, we have evidence that the blueprint for telemedicine was in the works at UVA in 1998, when the first business plans for telemedicine were developed. And it's wonderful to now see the fruits of those early ideas unfold and to benefit our students, faculty, and staff. We've already seen UVA telemedicine applied through our Healthy Appalachia Institute, the remote area medical or RAM clinics, the health wagon here in Wise, and I'm glad that our college community can also reap the benefits of this 21st century world-class offerings. So without further ado, allow me to turn the program over to our speakers. It is my distinct pleasure to introduce Board of Visitors member and Chair of the Committee on UVA Wise, Elizabeth M. Cranwell. Elizabeth has extensive experience in Virginia politics at both the state and national levels. She was press secretary for Congressman Rich Boucher, a native of Abingdon, who represented Virginia's 9th District in the U.S. Congress from 1983 to 2011. A native of Northern Virginia, Elizabeth now lives in the Roanoke area. She's worked hard in the community, serving on numerous boards and commissions and focusing her efforts in the area of education. She was appointed to the UVA Board of Visitors on July 1st, 2016. Please welcome Elizabeth.
Thank you, Chancellor Henry, for the opportunity to say a few words today. On behalf of the Board of Visitors, I want to extend a sincere congratulations to UVA Wise on the opening of the UVA Student and Employee Health Wise Clinic. The clinic will be transformational in many ways, but none as important as the access it will provide to high-quality health care to faculty, staff, and students who make up the community of UVA Wise. Unquestionably, the opening of the clinic will enhance the quality of life here on campus, but it also provides an opportunity for the UVA health system to further its mission of providing world-class health care in the Commonwealth of Virginia. It marks just the kind of collaboration between the University of Virginia and UVA's College at Wise that demonstrates the symbiosis of the relationship between these two fine institutions. And I look forward to collaborating with the College Board and the administration as we work to identify more and more ways and more opportunities like this to work together. But today we celebrate the opening of the clinic. And again, I want to say congratulations to the UVA Wise community on this very important and historic day. And to all of you here, I'd like to say, be well and health wise. Thank you.
Thank you, Elizabeth. Now it is my distinct pleasure to introduce Marcia Adams Gillum, a native of Norton, Virginia, and a 1982 graduate of the college. Marcia serves as chair of the UVA Wise College Board and is a friend and strong advocate for both the university and our college. A successful businesswoman, Marcia and her husband, Marvin Gillum, have been generous benefactors in the arts and education in Southwest Virginia. Please welcome Marcia Gillum.
Thank you. Good afternoon, Ms. Cranwell, Chancellor Henry, Ms. Perkins, and Mr. Valdez. It is a pleasure and a joy to gather today to celebrate the opening of the new UVA Health Wise Clinic. This clinic is a significant step toward improving and increasing access to health care in a convenient and affordable fashion. Fellow College Board members and I meet at least 5 times a year to advise the Chancellor on a number of issues pertaining to the college, from enrollment to tuition. We are stewards of the college. Many of us are alumni of this great institution. As we meet, we have in our minds, first, the health of the college in every sense: academic health, financial health, personal health, and well-being. By health, I don't just mean the physical absence of disease, but the ability to develop and thrive as an institution, as individuals and a community in the financial, academic, and personal realms. So this news came to me and to the members of the board as a very positive development. In addition, I think this collaboration is a reflection of the excellent strides made toward strengthening ties between the university and our college. We know that the college years can be physically and emotionally challenging for students. As a businesswoman, I also understand the importance of maintaining a healthy workforce. Both students and employees will be well served by the excellent care that the UVA health system is well known for. I am sure the clinic will be a boost to productivity and to wellness across the board. I would like to echo Chancellor Henry's gratitude. Many thanks to both Dr. Shannon and Chancellor Henry for making this possible, and thank you for devoting important financial and human capital resources to realize this vision in record time. I look forward to hearing more about the successes of the clinic. Thank you.
Thank you, Marcia. Charlotte Perkins joined the UVA Health System in 2016 as Corporate Development Officer. Prior to joining the UVA Health System, Ms. Perkins served as Vice President Retail and Strategic Projects for Bon Secours, Virginia, an integrated healthcare system based in Richmond. She was responsible for the operational performance of 79 physician practices, and her accountabilities included finance, quality of care, staffing, compensation, scheduling, and revenue cycle performance and compliance. Her other roles at Bon Secours included Vice President Marketing, Advertising, Public Relations and Development, and Interim Chief Operating Officer for Bon Secours Medical Group. Please welcome Charlotte Perkins.
Well, I know many of you were expecting Dr. Shannon, and he asked me to make sure and send you his regrets. You may or may not know, but the pilots were actually ill, and they really were, 2 of them, and we could not bring the plane down, and he is actually on service tonight. He is actually doing more than just running a health system. He's actually a cardiologist, and he is on service tonight through the whole weekend, so he had to be back by 5 to begin service, and there was no way driving to do that. So his apologies. I will try to convey his thoughts. He would do it much more eloquently than me. But first, I want to just say, what a beautiful campus. I love it here. I am originally from Kentucky, so this is like coming home to me. Mountains, views, all the friendly faces. I've met the maintenance guys this morning who gave me grief about being from Kentucky, which is fine. But I would also say I love the accents, because I turned around this morning, somebody said something, and I thought my sister was in the room. So I've lost a little bit of mine, but not all of it. So thank you all so much for being so welcoming to me. Today truly does mark a historic day, not just for UVA-wise, but for UVA's health system. This is a first of our kind. We've never done an employee and student health clinic combined, ever. So we're pretty excited about it. You're the first, and hopefully this will not be the last. But this new model really will serve and do the things that we think we need to do for the health of our employees, your spouses as well, and our students. It will serve both your physical and mental well-being, which we think are both important. It also gives us the ability to expand the Be Well program, which we also think is important, because that helps you to achieve your goals, your personalized health goals, to reach the healthiest you can become. We believe it is truly an honor to be able to serve every single one of you. I know that the staff feels that way. You know, the first time I talked to Johnny when we were interviewing her, she said to me, it would be an honor for me to be able to serve the people where I grew up. And I thought, you know, she's the one. She's the one that we should hire, because she cares about the people of this community. This clinic would not be a reality without so many people's support. And I will get emotional, because this has been a true labor of love for us. It really has been. The entire facilities department, even though you gave me grief this morning, you have been amazing. They have hung stuff, they have painted, they have done everything without one iota of a complaint. They've always been here to help. John Carter, I don't think he's here because I don't think you let him come because you said he really didn't help that much. So that's what Rachel told me, okay? So John actually did help a lot with building permits and plans. And Rachel, you've been a delight. I got to meet you this morning. It was wonderful, but Melissa tells me you're her boots on the ground when she's not here. Chris Boggs and his team, I don't know if Chris is out there, but Chris did all the wiring and computer work, and that may sound easy, but when you're trying to do telemedicine, it is not an easy thing to connect into UVA in Charlottesville, particularly around all the security requirements. So thank you, and Susan Heron on the phones. I really want to take a minute and thank Melissa. She's been wonderful. She loves coming here. She thinks of you all as family. I wonder if I'm ever really going to get her back. I swear, I do. She tells me all the time, I love my Wise family. And speaking of hiring, you know, Melissa, she's done everything, right? She helped hire, she's painted. I told the story this morning that we had no idea we needed a Class C DEA drug license to operate a clinic that has no narcotics in it. But we did, and Melissa must have gone through I don't know how many inspections to get us there, but we got here. We got our supplies, we have our lab contract, and all of that is because Melissa works diligently on those tiny little details. So Melissa, I thank you. But from a hiring perspective, Johnny, you've been a delight. Many of you would not realize that Johnny has not been home with her family for about a month and a half, except on weekends. She's been in Charlottesville, Virginia, because this is the farthest remote clinic that we have. It is actually a clinic of the Department of Internal Medicine under Mitch Rosner, Chair of Internal Medicine's guidance. They needed to ensure that Johnny really was prepped, ready, and knew everything she was doing because, again, her oversight is being done through telemedicine. So Johnny has had to be at UVA in Charlottesville, away from her family for about a month and a half to make sure that she had all the knowledge, training, and everything, and that she truly had what she needed to be credentialed. I am very happy to say she has been credentialed, and we're happy for that. So Johnny, I know she hates the spotlight, but thank you, Johnny, for going through that, and I thank your family for sacrificing you for a while. There's really two other people we want to thank, and that is Chancellor Henry and Vice Chancellor Rusty Necessary. I got to meet you, Rusty, and I've heard all these stories about you. You probably don't want to know all of them, and I can't tell some in public, but we thank you for your continued support of this new concept and the vision that was really, truly needed to bring it here. So thank you all so very much for giving us the opportunity. We know that care sometimes has been limited for our students, employees, and spouses. This clinic will bring that care to your town, your place of work, and your study here at Wise. And we at UVA are honored to serve you, so thank you.
Okay, thank you so much, Charlotte. I appreciate your remarks. I now have the opportunity to introduce Peter Valadez. Peter is a second-year student from Northern Virginia, majoring in biology with a minor in public health. He's involved in several organizations on campus, some of which include the Student Ambassadors Program for the Office of Admissions, the Student Government Association as a second-year senator, and Circle K International, for which he serves as president. Peter is also a resident advisor for the Cavalier Trails community. I'm so thrilled to have you as part of our UVA Wise family, and please help me welcome Peter to the lectern.
Thank you. Thank you, Chancellor Henry, for that warm welcome. As mentioned before, I'm Peter Valadez, and I'm honored to be here with you today. I'd like to thank Chancellor Henry for giving me the privilege to speak to you today, and on behalf of the student body. I'd like to personally thank and acknowledge the following individuals: our nurse practitioner, Johnny Bledsoe, our clinical staff, Lisa Fisher, our administrative team, Starla Heward and Jamie Sowards, for the dedication to the healthcare profession. I'd also like to thank Dr. Rick Shannon, UVA's Executive Vice President for Health Affairs, who could not be here today, for introducing the idea and advocating for the UVA Student and Employee Health Clinic. I'd like to acknowledge Charlotte Perkins for being here on Dr. Shannon's behalf, Elizabeth Cranwell, member of the UVA Board of Visitors, Marcia Gillum, UVA Wise College Board Chair, Amy Salerno, the Medical Director of UVA, and lastly, I'd like to thank the project manager on grounds, Melissa Webb, who helped facilitate our health clinic on our campus. As the Chancellor mentioned, I'm involved in several organizations on campus. So shortly after this ceremony, Ms. Bledsoe, I might need a stress test. For me personally, the addition of our new health clinic is innovative. It is gratifying to see the progression our college is making with the assistance of our sister institution. With our new health clinic in place, this offers a world of opportunity to any UVA-wise student. Our new healthcare facility not only offers medical services, but gives small insights to healthcare professions. Students seeking jobs in the healthcare profession after undergrad can utilize our health clinic to gain a personalized interaction with professionals of the field. With that being said, the health clinic will provide a variety of services based on individual student need, some of which include prescription-based antibiotics, medical screenings and testings, as well as lab services with potential fees not associated with the UVA health clinic. Coming from Northern Virginia, I personally saw a greater need for healthcare in the rural area, which I now call home. UVA-wise provided some opportunity for student healthcare, but students often had to travel off campus to receive treatment, which led to small financial burdens upon students. Not all students had ample resources to receive treatment, and in many cases, this would keep students from seeking the care they need and deserve. For all students who had the resource available to them, such as transportation and insurance, faced the challenges of missing a class or running into a conflict in their schedules, adding unnecessary burdens upon students. But with the new health clinic in place, I now see every student at UVA-wise has access to full-time medical personnel. Looking towards the future and what this means to our college and future students is truly remarkable and impactful. As a student ambassador, it is my responsibility to provide student-led tours upon request. I remember a day when I was giving a tour to a prospective student and her mother. I happened to reach the steps of this building, and I spoke about our health clinic at the time and the services they provided. The mother was very taken aback and wondered where the nearest urgent care was in the case of the provider being out of the office. I assured her that an office was available in Norton, 10 to 15 minutes down the road. I was able to reassure the nervous parent that although our health clinic may be limited, our professional staff would tend to her daughter's needs and, if not skilled enough, would ensure her medical needs were met. When the parent expressed her concern to me, I understood then and there that our health clinic needed to evolve to meet the needs of students. Although I did not know how to express my concern, I knew that something needed to take effect soon. As I made the journey back to Wise this fall, I was informed of our new health clinic and was thrilled with the good news, not only as a student, but as a student representative of our college. With my involvement in several organizations, I knew I would be able to communicate and educate my fellow peers to the new health clinic and alert them of the newly available resources that are being offered. The opportunities that the new health clinic will be providing are endless and will be beneficial to any UVA-wise student who decides to utilize the health clinic. In closing, I would like to start out with a small acknowledgement to my friend Grayson Prulix, who could not be here today, but thank her for helping me prepare for this speech. I would now like to take this time and thank the medical staff who will be servicing our campus for many years to come. I'd like to thank the founders of the UVA Student and Employee Health Clinic, members of the board, and all of you for being here today. Lastly, I'd like to thank Chancellor Henry for allowing me to speak today on a topic that I hold close to my heart. Thank you.
Thank you so much, Peter, for your remarks. I think that really showcases the need and hopefully the demand. So I think you will all be very busy with the clinic fully open. So now I would like to call all speakers to join me in the ribbon cutting. So
I get the big scissors.